4,000% explosion in presentations of children with gender dysphoria. That is, children who are have a psychological disturbance in relation either to their sexual body. There are a number of pathways to this, and there's been a great pressure to affirm these children as being trans, for example, when they present, without appropriate exploration. 35% of these children are on the autistic spectrum. A large number of these children, and this has also been acknowledged by the LGB Alliance, a large number of these children are gay and lesbian children who are suffering in relation to their sexual orientation and need to be helped to understand themselves better. So that is, they have what we call an internalized homophobia. They hate themselves, they hate their sexual body, and they want to get out of it. What is really, really important in these instances is to recognize the terrible suffering of these children and not to precipitately label them as trans and put them on a medical pathway which has irreversible consequences. Now, the reason I say all that is because there's been a tendency to interpret the Memorandum of Understanding, which is the professional framework, as implying that children and young people who present with gender identity issues should be immediately affirmed. And this that's caused damage. Now, why the legislation is a problem here is, given that there's no definition of it, our great concern has been, for example, if a clinician meets a child who has various disturbances, such as internalized homophobia, such as 70% are girls, and why are all these girls presenting with hatred of their sexual bodies and wanting mastectomies and organs removed and so on? This needs careful